Hi guys, welcome back. This is Kel and I'm here today to talk about another very important topic, which is how to recover from open heart surgery. So I'm just going to be sharing some of the tips that I learned from my open heart surgery experience. If you're new here, then just a little bit of background about me. I had an aortic dissection a few months ago, a little over 3 months ago, almost 4 months ago now, and I ended up having open heart surgery. It was my first time having open heart surgery, and so I kind of had to learn a lot of things from that experience because it was an emergency surgery. I really didn't have time to prepare. I didn't have time to even pack a bag of clothes to take to the hospital. I just went straight from the place I had my dissection to the hospital to surgery. So these were just a lot of things that came up all at once, and it's really important to have a plan or to at least have some idea of what would be helpful to recover from this, because open heart surgery is such a stressful surgery in itself that, you know, being comfortable is the least we could do. At least have some control over our comfort and over just having something organized and planned amidst all the chaos of this surgery. So hopefully these tips today are helpful. As always, I would absolutely love if you like this video and you subscribe to my channel so that you can stay up to date with all my new videos, and I'll hopefully be posting a lot more things soon. And I just want to say a quick thank you to all of my new subscribers and everyone who gave me amazing positive feedback and messages after my last couple videos. I've been so hesitant to make YouTube videos because I honestly didn't think anybody would watch them. So it really makes me really happy to read all the positive messages and just stories from people telling me that I've helped them or inspired them is honestly all I could ever ask for. So thank you so much. I so appreciate it from the bottom of my heart, and I'm really excited for this journey that we're all going on together. Okay, so my first tip is to bring hygiene items and an appropriate pair of clothes to the hospital with you. So first, let's talk about hygiene items. What I mean by that is I would highly recommend bringing deodorant, bringing wipes that you can wipe your body down with, and something that you can wipe your face with to just stay clean. This might sound kind of trivial, or you might just be like, I'm in the hospital, why do I care if I'm clean? I don't know. But let me tell you something. When I was in the hospital, because my surgery was emergent, like I said, I had a very rough time in the hospital. I was adjusting to everything that happened. I was extremely depressed and negative, and I just didn't want to do anything. I literally didn't even turn the TV on in the room once. I ate maybe a grain of rice. Like, it was bad. I was not happy. And despite my husband being an amazing husband and bringing me all of the hygiene products in the world, I didn't use a single one of them because I was so upset. So because of this, I was dirty. I didn't shower or wash myself really for a good 5 days. And I don't know about you, but that's a really long time to not wash your body. At the same time, maybe this is too much information, but I think it's relevant to the story. I was afraid to use a razor to shave any of my body hair because I was afraid that I was going to cut myself and I'm on warfarin and it might cause a bleeding situation. I now know that that was very irrational, but in the moment, that's what my mind was just telling me. So essentially, I didn't shower. I had a lot of body hair. I came home from the hospital. I put on deodorant for the first time in like 10 days or whatever after not showering for however many days. And then I developed the absolute worst case of folliculitis in my underarms. It was horrible. My armpits were swollen. They smelled horrible. They were pustular. It was disgusting. And I had fevers because of this. Fevers of 102, 103. It was just a horrible situation. So this is why I circle back to hygiene products are very important in the hospital. Please don't make the same mistake I did. Please wash yourself. I know it's disgusting that I didn't wash myself for that long. Please don't judge me. But I'm telling you now, learn from my mistakes. Please just bring something to keep yourself clean. you just feel good when you're clean. You feel good about yourself, and you feel like life is a little bit better when you're clean. So in terms of the clothes that you would bring, I would highly recommend just picking up a couple of button-up like cotton or linen shirts, something just very loose, very comfortable. And of course the button-up is because your sternum was just cut open and titanium wires sealed it back together, so you're not really going to be able to be swinging your arms around and picking them up and putting them down. So it's just better to put a button up on, so somebody could help you just put it over your arms and you can easily button it up yourself instead of having to struggle with putting a whole t-shirt over your head. In my case, I ended up having to wear one of my husband's t-shirts, and then the nurse brought over a pair of scissors and just cut a deep V-neck in that shirt. So it was real stylish, my outfit leaving the hospital. Honestly, if you're looking for just like a cheap button-up shirt, go to Goodwill or like a thrift store. I found so many button-up shirts there in the past. That would be my dog hacking up something in the background. Don't worry. So if you're just looking for something easy that you don't really have to invest a lot in and that's just comfortable, I'd recommend starting there. Maybe just searching for something simple that you can wear and not really care about not wearing it ever again. And then just as far as the bottoms, of course an elastic waist is always the way to go, especially with surgery. I mean, elastic pants are just the most comfortable pants in general, so I'd highly recommend just getting like a nice pair of sweatpants or some shorts, because it's also very difficult to go to the restroom, and you definitely don't want to be finagling with buttons and zippers and trying to do that whole thing while you're recovering. It's just so much easier to have an elastic waist. Okay, so now let's talk about sternum precautions. So you may have heard of sternum precautions. If you're already past your heart surgery, you may have heard the nurse talking about it a little bit. And if you're going into your surgery, I'd highly recommend Googling sternum precautions and just getting a whole World Wide Web full of all the sternum precautions ever to exist in this world. So I'm gonna just go over a few that are kind of the ones that stood out to me and the ones that I felt like were the big ones, the most important ones. Essentially, sternum precautions is just this set of guidelines that have been developed that prevent you from damaging your sternum. So like I mentioned before, I mean, in open heart surgery, your sternum is cracked open and then it's put back together. So it does need to heal. It takes roughly 6 to 8 weeks for a sternum to heal completely. And so there's a lot of precautions that need to be taken in the meantime to aid in the healing of your sternum. So because of this, you cannot do certain things like driving is not recommended within that 6 to 8 week period, because if the airbag comes out and hits your sternum, obviously that's not going to be very comfortable for you, and it's not really, yeah, it's just not going to be good for anyone if that happens. So avoid driving, avoid sitting in the passenger seat or the driver's seat for the first 6 to 8 weeks after your surgery. Speaking of the car, if you do need to ride in the car, it's always recommended to sit in the back seat and have a pillow wedged in between your chest and the seatbelt strap. And that just prevents the strap from putting any extra pressure on your chest, like if the seatbelt needs to lock or if it pulls on you. It just really makes it a lot more comfortable for yourself. Some other sternum precautions that are really big is also to avoid pushing or pulling anything. So that would kind of look like a lot of different situations, but the biggest things I would say, like if somebody's trying to help you get up from the couch or get out of bed, don't let them pull you by your arms and don't grab onto them for support. A good way to remember how not to instinctively do that is to put your hands in an X across your chest. So kind of something like this. By putting your hands like that every time you get up and sit down and get out of bed and get into bed, it prevents you from just instinctively putting your hands down to catch yourself or grabbing onto something, because that motion of pulling and pushing can put some pressure on your sternum as well. You also want to prevent putting your arms behind your back. So that would be just reaching into your back pocket. Even just putting your phone in your back pocket, that is recommended to avoid, because that causes a little bit more pressure on your sternum as well. And so you just don't want to do anything in that range of motion. And then as far as range of motion, you also don't want to lift your arms above your shoulder height. So you can lift your arms up to about here, like shoulder height, but you don't want to be lifting your arms up in the air and swinging them around or anything like that. If you have to reach something overhead, try to get somebody to help you, because it's really not recommended to be doing that until your sternum is completely healed. So like I mentioned with sternum precautions, a really awesome way to prevent yourself from accidentally grabbing something or pulling something is to have your hands across your chest. So something that actually is really going to help you with that too is to have a heart pillow. So if you've never heard of a heart pillow, it's exactly what it sounds like. It's a pillow in the shape of a heart. So I have an example here that I will show you. This is a heart pillow. I don't know if you can see me. That heart pillow was made for me by my nurse. It is honestly the most fantastic heart pillow probably ever created. Fun fact, my nurse actually was a childhood friend that I hadn't seen in probably like 10 to 15 years, and she happened to be my nurse, which was really crazy and super awesome. And then she so kindly made me this heart pillow, which I literally like am so emotionally attached to. Like, I carried that everywhere with me for at least a month and a half after my surgery. In the hospital, they also gave me another heart pillow that was a little bit smaller, a little bit flatter, but really for the first, I would say 6 to 8 weeks while my sternum was healing, having a big, thick heart pillow was so instrumental in preventing having more pain. So the way that I used my heart pillow was I held it against my chest every time I got up from a sitting position, every time I needed to sit down, every time I got up from laying down, or I needed to go back to lay down. I held that pillow over my chest with just a little, like a medium pressure to keep my sternum stabilized. I also used the heart pillow quite a bit when I needed to cough. After my surgery, I did have a lot of issues with my lungs. I had a collapsed lung as well as some fluid around my lungs, so I had to cough quite a bit. And if you've ever had to cough after open heart surgery, you know that it's not comfortable. I mean, you can probably imagine. So it's so helpful to have a heart pillow, and I say heart pillow, but honestly, you can use any pillow that you can hold up against your chest and apply pressure onto your sternum. You don't want to be pushing it too hard, but when you're coughing, you just hold it against there just so that you have a little bit of resistance, and so you don't feel like you're coughing your chest wide open. So heart pillow, or just any pillow that is thick enough to hold against you and just provide some comfort, is so helpful, and I would highly, highly, highly recommend it. I wish that my nurse friend could make heart pillows for everybody, because honestly, it's the best heart pillow ever. Not that I've really had that many heart pillows, but I think it's amazing. Let's move on to sleeping. Sleeping is a huge part of recovery from any surgery, especially from open heart surgery. Getting good quality sleep is so important for healing and just feeling better and getting back into your normal routine. The issue is that it's really hard to sleep after open heart surgery. It's not comfortable. You have a giant incision on your chest, you're in pain, you can't really move. And for me, the worst part of sleeping is you have to sleep on your back. For some reason, I've always had this notion that people who sleep on their back, like who willingly, with all the other options in the world, you willingly choose to sleep on your back, then you're probably a psychopath. I'm just kidding. But really, I don't understand how people sleep on their back when you can sleep on your side, you can sleep on your stomach. Like, that is so much more comfortable. I don't get it. So essentially, open heart surgery, you pretty much have to just sleep on your back, and it's not always comfortable because it is difficult to lay down. You won't be able to lay flat for quite some time. Usually until your sternum is healed, you kind of need to be a little bit elevated. Because of this, a lot of people like to have a recliner chair to be able to sit in and to even sleep in sometimes. And some people like to use a wedge pillow. From my personal experience, I ended up having a recliner chair given to me as a gift after my surgery, and I did like sitting in it just kind of to relax, but when I tried to sleep in it, it really wasn't comfortable to me. But I have heard that some people really do appreciate having a recliner because it's a lot easier to adjust, and you can kind of adjust it to your comfort level, and obviously it's just easier to use a lever to move yourself up and down and be able to get up that way. What I did is I kind of created a wedge pillow out of a bunch of different pillows, which is also an option that you can do. Looking back, honestly, I recommend just going onto Amazon or somewhere and buying your own wedge pillow that you can put on your bed and you can use to lay down. It's essentially exactly what it sounds. It's just a pillow in the shape of a wedge. So it kind of starts off a little bit tapered down, and as it gradually goes up to the head of your bed, it has a more elevated edge. So that allows your head to be more elevated. So if you don't have access to a wedge pillow, or you just don't want to worry about going out and buying one, you can also kind of create your own wedge pillow, kind of like I did. My husband actually just took a bunch of regular pillows for the bed and the couch and created a wedge shape out of those pillows. I will say that it's probably not as comfortable, and through the night you might start falling through the cracks of the pillows, but it worked for me in my recovery too. Just as long as your head stays elevated and your chest is elevated as well, it makes it a lot easier to sleep. For the first couple of days, maybe the first week after my surgery, I did sleep essentially sitting up almost. My back was pretty upright, and that was really the most comfortable position that I could be in because I did feel a lot of tightness and pressure in my incision area. But as time went on, I was slowly able to lay down. It took me a couple months to be able to lay completely flat, but I do, when I wake up in the morning, I do still feel some soreness in my chest muscles. So I think that's normal, and it's something that will last for quite a while. I think it's normal to just have some residual pain, but it shouldn't be anything so severe that you can't lay down at all. If that's the case, then definitely talk to your doctor because there might be something else going on. But overall, in your recovery, doing all these things will make you much more comfortable physically, but don't forget to take care of your emotional and your mental health also. Open heart surgery, especially in the case of aortic dissections or emergency surgeries, is very emotionally traumatizing. It's not something that is really great for the psyche and the mental health. So make sure that you have some way to process those emotions. I know definitely after the first couple weeks of surgery, after the shock of everything has worn off and you're kind of easing back into life, then those emotions might start to come up, where you might feel a little bit more anxious or feeling like sad feelings or angry feelings. So it's really important to be able to process those emotions as well. Try to get those out because that will make you feel better too. It is quite a long process. That's something that I'm still working on too. And it's not something that's going to be resolved right away, but just something to keep in mind. It is normal to feel that way after surgery, to not feel great emotionally or mentally. And it's something that just gets better with time. I would recommend reading some books. I can put some in the description below, some of my favorite books that I read during this time and just tried to use to be able to change my mindset, try to be more positive so that I could help in my recovery. Because really staying positive is the only way that you will make it through recovery. Having a positive attitude is so important for healing. Really, the power of the mind is powerful. So you want to just stay positive, and that will actually help your body feel better and help you recover faster. And so I highly recommend incorporating that into your recovery as well, and don't neglect your mind and your feelings. Thank you guys so much for watching. I really appreciate it. If you enjoyed this video, please give it a thumbs up and like this video. And if you want to see more videos that I make in the future, please subscribe to my channel. That would be really awesome. I really appreciate it, and I hope everybody has an amazing day. And if you're going to heart surgery, I'm wishing you the best in your surgery and recovery. And please let me know how your recovery goes, and hopefully these tips are helpful. Have an amazing day, guys. Bye.